fill out a little form, and my little form said, you know, are you on medication? Are you under doctor's care? When are you recently hospitalized? You know, nope, all good. But that she'd had some pain, and she had gone and talked to a doctor recently. She'd been diagnosed with endometriosis. Okay, I was like, okay. And she described her symptoms, which sounded a little bit like Crohn's disease to me. Okay, but I didn't say it. I'm just saying this was what was in my head. So she was like, "Yeah, I want to do this," and she committed to a therapeutic day, and she came in and we started doing this. And initially, she wouldn't talk very much, and she was pretty simple about her answers, lots of yes or no answers. Not too much elaboration, or she would elaborate about things that just seemed to be completely unrelated. Okay. And so I was just working on her, and she was doing really good, actually. And she was saying that she was having a lot less pain and so on. And I was kind of happy with that. I came to day number 5, second supine, and which I always think of as a fairly intense session. You know, it's like if you're focused, it should be, right? Because, you know, you're in the garden of delights. You've got to pay attention, right? So I told her, you know, I asked her, I said, so let's pull up your shirts and we'll look at your belly, you know, pull her pants down a little bit. And there was a scar that big around, a big puckery, woundy kind of scar. But the only other time I've seen scars like that are in gunshot wounds. Okay? And I would have remembered if she put a gunshot wound on her intake form. If she had mentioned it, I would have, you know, abdominal pain, you know, and that there's this thing, you know. It was so big that, again, she's just, you know, kind of like this, and without asking her, I just reached under, because I said, this big of a wound has to be have an exit, right? And so when I put my hand under it, sure enough, there was a slightly larger scar than this big one on the back side of her abdomen. Through and through, right here, through and through, completely through her abdomen, in the front and out the back. So I go, Carolyn. She opens her eyes, I go, look at me. And she looks at me and I go, what is, and I have my finger out like this, I go, what is this? I'm going to put my finger on the scar. And bless her heart, she goes, she whips her shirt up and bends over to look at it like she doesn't know what I'm talking about. And she goes, oh, yeah, I forgot. Word for word, I'm not paraphrasing. Oh, yeah, I forgot. And so she tells me a story about how she was a bicycle messenger in Chicago, and she was going over one of the bridges, maybe the Wells Street Bridge in downtown Chicago, which is really kind of steep. Okay, the little bridge kind of goes whoop. It's a little drawbridge at the top, but on the whacker side, it's pretty steep coming down to the sidewalk, you know. And for some reason, she was going a little too fast, and she overshot the curb at the end of the bridge as someone ran the red light. So two things come together, you know. She kind of overshot the curb as a car making a hard right turn ran the red light. Okay? They were supposed to stop before you turn onto the bridge. They didn't. They nailed her. And her handlebars went completely through her abdomen and punched her kidney out the backside. Oh. EMTs, fire department shows up. They take a saw and cut the handlebars off the bicycle so she'll fit in the ambulance.
Aww.
And take her and the handlebars, and where she then has surgery, and she was on dialysis because she lost the kidney completely. And she was on dialysis for 2 years before the other kidney picked up enough function that she could get off of the dialysis, and this was only 5 years before the session. Only 5 years.
How do we forget stuff like that? Why?
It's easy. That's not even a hard question. The body does actually, you might think you remember pain, but you really don't. You remember the memory of pain, but you do not remember the pain. And it's quite normal for people who have really incredible trauma to block it out completely. That's the most normal thing in the world. It's not unusual. It actually happens quite frequently. It's part of what we call post-traumatic stress disorder. And see, before this was studied, they just knew that people blanked out traumatic events. They didn't realize it was part of a profile, a psychological profile, right? Now I go, oh, okay. And so I'm thinking, endometriosis, huh? I'm like, no, I mean, come on, think about it. Through and through the abdomen plus reconstructive surgery, how much scar tissue in her abdomen? And could there be scar tissue from the womb encroaching on the uterus? Could there be? It grazed the uterus. The fascia was like a bomb went off. You can't even surgically correct that. All they do is clean it up as best they can. They can't put it back. Why? It's a thin filmy sheet and it's under tension. Think about it. If you blow up a balloon till it pops, how hard would your job be to sew that balloon back together? That's what happens when fascia is exploded. Okay? And all the little remnants, all the little rough ends that aren't taken care of become sites of encroachment of further scar tissue. They become a nexus, a node of encroachment of scar tissue. That's why those kinds of wounds have very complex patterns of scar tissue. It's not plain, not on a plane, right? It's going every which way, right? Well, so I worked on her. She got better, okay? And I changed my tactic because I went into scar tissue now, okay? Went into really long, strong, deep stretches with lots of breathing, where we're holding them long enough to actually get microscopic tears, actually get where some of the adhesions actually break loose and tear, have enough sustained pressure right on the crisp edge. So then with mobility, the fascial planes heal, but they heal more distinctive and more separately. It's a tactic that actually works really well, okay? Especially for things like hamstring tears, where you get encroachment on the adductor magnets or what have you, okay? There's all kinds of ways you can do that. But the thing about it was, I didn't know to take that direction with her until session number 5. I was already 7 hours hands-on with her before I found out what was really going on with her. 7 hours. If I just spent 11 minutes with her, doing my assessment, just recommended, oh, you're just stressed. Let's just do some stress. Or maybe you just need, you need some uterine herbs. Relax your uterus. Okay? Not saying it might not have helped a little bit, but it certainly wouldn't have addressed her primary issue at all. Okay? So, Therapeutic Day gives us 7 different opportunities to connect with the client. And here's another thing I found out, that people who commit to programs get more better more often than people who do not. I think it's a commitment thing. I think that if all you're committed is to be with me 45 minutes, then there's only a certain amount of healing that you will allow yourself to have. Because that's your commitment, 45 minutes. If you know you're committed to be with me for 7 weeks or 7 months, okay, your engagement is completely different. You see, and for me it's different. On the practicing side, it's very, very different. Okay? Therapeutic Day can be done every day for 7 days, every other day for 14, every third day for 21, once a week for 7 weeks, or once a month for 7 months. Technically, the closer the sessions are together, the better it seems to work, but it will actually still work even if you only have to work on the person once a month for 7 months. I've actually seen very good results. I don't know how that works, okay? My logical mind says if all you do is come to see me for one session once a month, there is no conditioning effect. So the physiologist part of me has to acknowledge that there's no physical conditioning effect if you only come once a month, okay? But people actually do have really good results, even when they come just once a month. I call that grace. Grace. I believe there's grace in what we do, and that's where we see it. Like, where do you see the grace? Well, you see it when there shouldn't be the results that you get, but you're getting them anyway. Why is that? Some people say, well, that's the placebo effect, okay? You know, because you convince them that they should have a benefit. By the way, in natural medicine, we don't really care if it's placebo. We're actually okay with that, okay? I'll give you a for instance. Uterine cancer, on a tamoxifen trial, you would expect a positive, a 50% reduction in breast cancer for 1 person out of 100 in a tamoxifen trial, okay? And that's, and they would expect some positive result for 2 people, and you'd get 1 for 1, and so it's called a 50% relative benefit, all right? If you run the same trial, instead of using the drug tamoxifen, you use a sugar pill, okay, 16 people have a positive result. So actually, you get a greater statistical benefit from the sugar pill than you actually get from the drug. So from my point of view, I'm just going to give you the sugar pill and wish you well. Because statistically, the idea that you will actually have a better result is actually higher. The numbers are more in favor of the sugar pill than they are in the drug, based on real statistic, not a relative statistic. Relative statistic is for marketing. Real statistics are the actual number of people who had a benefit. You understand? And nobody ever dies from a sugar pill.
Yeah, no side effects either.
No risk of death, none whatsoever, at all. You know that because you know people eat Twinkies and Hostess cupcakes with a 6-pack of Budweiser every day for 40 years, and they're just fine. Really? I mean, they can get out every morning and haul those alligators hand over hand into their little flat-bottom boat, drinking Budweisers and eating Hostess Ding Dongs, and I can't do that. You know, it's hard work. You know, was it hand fishing and hauling alligators and all? That's hard work, and those guys drink like fish and eat terrible food. You know, so I don't think there's too much of a risk. All right. So Therapeutic Day is actually is the basis for the SomaVeda clinical method. And technically, you're not doing SomaVeda unless you're doing the 7-session protocol. Okay? I don't expect you to see the kind of benefits that I see or that Lydia sees in sessions unless you're doing the 7-session protocol, because you don't have enough contact time. And you're not doing enough variety. You see? By changing the attitude, we're actually, if you think about it, the way it works in the body, energetically, let's do a cross-section on the leg. Here's a thigh, thumb, here's a femur, okay? And here's that imaginary center line. Okay, now here's the energy lines. 1, 2, 3, 4, 5, 6, 7, and there's one on the back. 8, 9, 10, 11, 12. It's not drawn to scale. Say there's 12 lines. If I looked at this as kind of a pie chart, about every 15 degrees that I approach the center mass of the thigh, I'm on a different energy line. It's 12 lines. Okay? About every 15 degrees, I'm on a completely different energy line. So when I'm going through the sequence in the 5 attitudes, every time I change the person's position and bring pressure to a line, even if it's the same line, but I'm coming at it